We have Dr. Karbi from William Osler Health System with us. We'll be discussing about how to prevent cold, flu, COVID-19 and RSV. So Dr. Karbi, welcome to our show.
Thank you for inviting me.
Dr. Karbi, if you can introduce yourself to our viewers, that will be great.
Great. My name is Oscar Karbi. I'm a full-time staff emergency physician at William Osler Health System.
So Dr. Karbi, what are your 5 tips which you want to give to prevent COVID-19, flu and RSV?
Well, the first and foremost and probably the most important is to get vaccinated.
Sure.
Because that's our primary line of defense against these viruses.
Okay.
Right now, in the middle of January, we're right in the middle of the peak of influenza season. Influenza is a virus that starts affecting us mostly from December to February. And as it so happens, this is January 17th.
Yes.
We're right in the middle of that period of time. So our primary defense against a virus like influenza is vaccination.
So first tip is get yourself vaccinated so that you don't get a flu.
Yes, please.
Okay.
And it's not too late. A lot of folks believe that they missed the opportunity when the vaccine came out in October and they didn't get their vaccination, but it's not too late. The influenza season actually extends itself from November to May.
Okay.
And there's still significant numbers of patients that get infected. So it's never too late. It takes 2 weeks for a person to build up antibodies after they get vaccinated. So the earlier you get your vaccine, the better. And you can speak to your family physician or your local pharmacy provider and arrange to get yourself vaccinated.
So this is your first tip. Dr. Karbi, on this, I have a question that many people, they have myth that if we get a flu shot, definitely we will get sick. So that is the myth with them. So what is the benefit of having a flu shot, and those who skip these shots, what you will say to them?
Well, I do recognize that some people believe, and a lot of patients do tell me that they believe that every time they get a flu shot, they get sick. There is a certain degree of immune response after getting vaccinated, so everyone feels a little bit achy, perhaps maybe a low-grade temperature for a day or so, but that's our immune systems that are turning on once you receive your vaccine. You do not actually get infected with influenza. The vaccine itself is an inactive virus. And it's not going to cause an infection by getting vaccinated with it. Okay. It just induces an immune response that some people misinterpret as the beginning of a flu. It is not. If they happen to catch a cold or one of the other viruses like RSV or COVID, of course influenza vaccine does not protect against those. And a lot of patients misunderstand that just because they get a cold a week or so later, it means they got the flu. It's not the same thing.
Okay. So what is your second tip? Tip number 2.
Well, other than getting vaccinated, just as an add-on comment that COVID vaccines, as well as vaccines against RSV virus, which is the other 2 viruses that are very, very active right now, are also available from your family physician and your local pharmacy. So please consider getting vaccinated. People can also refer to the Canadian Immunization Guide. Health Canada runs a website, canada.ca, and there's a lot of very, very useful information about the vaccines, their indications, the age groups, where they're mostly appropriate.
And Dr. Karbi, is COVID-19 still there? Still people are getting infected with COVID-19?
Yes, they are.
Okay.
Yes, they are. We're seeing more influenza and RSV right now than COVID-19, but COVID-19 is still there and is still affecting people.
What is RSV, if you can tell about that virus to our viewers?
So RSV, or respiratory syncytial virus, is a winter respiratory virus that affects certain age groups. And again, the severity of illness from RSV varies from age to age. The most susceptible are the very young infants under 12 months of age, and the older patients that are over 60 years of age. And in those populations, the virus does cause more severe respiratory illness.
If in this winter season anyone is getting sick, how can they come to know that whether they have a flu or they have a COVID-19?
They get tested. Okay. There is a nasal swab, very similar to how the COVID virus used to be tested for. And the nasal swabs right now test for all of these winter viruses. The swabs that we do at the hospital is a test for all the viruses with one swab.
In this season, I got sick for 3-4 days, and I went to my family doctor, and I had a loss of taste in my tongue. I said maybe a COVID, because that was one of the symptoms in COVID-19, that loss of the taste. So he said, no, the COVID-19 is same as a normal flu now, so no need to test COVID-19, just is a flu, just take Tylenol regularly. So what you'll say on that?
Well, I guess your family physician was wise to treat you the way he treated you, because you got better.
Yeah.
And I hope your taste has recovered.
Yes.
But he is correct. There are times changes in taste or smell with other viruses. COVID itself is very, very prominent in that symptom.
So it's not that dangerous it was used to be?
It's not that dangerous, no. The severity of COVID-19 right now is not as it was a few years ago.
Okay. So Dr. Karbi, what is your third tip on this?
The third tip would be to wear masks.
Okay.
And as far as our hospitals, for example, are concerned, we would like people that come visit their loved ones in the hospital to wear a mask. It is mandatory in all patient-facing areas.
Yes.
And we strongly encourage that they wear a mask anywhere in our facilities as soon as they enter any of our 3 sites, Brampton Civic, Etobicoke General, or Peel Memorial. Masks are available at all entrances, and we strongly encourage everyone that visits our hospitals to wear a mask.
Okay.
As another suggestion is when people do visit indoor places with people and members of the public other than their immediate family, it is advisable to wear a well-fitted surgical mask.
Okay. And what is your advice to the seniors, more vulnerable population, the seniors above the age of 60 or 65? What is your advice to them in this winter season?
By all means to get vaccinated.
Okay.
Because that's the best protection against catching these viruses. There's other tips, of course, as we just mentioned, wearing a mask, washing one's hands, using hand sanitizer, trying to live in a well-ventilated space so that the viruses are not as prominent in the air we breathe. But getting vaccinated is their strongest defense against these viruses.
So Dr. Karbi, the 4th tip and 5th tip is get yourself sanitized, your hands sanitized?
Yes.
Okay.
And try to live in a well-ventilated home.
Well-ventilated home.
Yes,
Okay.
because viruses collect at higher concentration if it's not well-ventilated. And I know the weather is very, very cold right now, so it's very hard to open windows and let the cold air in. But please turn on the fan of your thermostat and at least have the air circulate well through your home.
So when you say get vaccinated, means get your flu shot. And what about other vaccinations also you are talking about?
Well, COVID-19 vaccinations are
Okay.
available, and again, you can refer to your local pharmacy for the up-to-date booster shots. But RSV vaccines are available,
Okay.
and RSV
So you
vaccine
say one should get a flu shot, COVID-19 shot, and a RSV
vaccination.
shots. Okay.
Yes,
Okay.
by all means.
Okay.
COVID-19 vaccine and the flu vaccine can be given at the same time.
I see.
The RSV vaccine is a little bit different, and it's advised that one separate the vaccinations by 2 weeks. So the RSV vaccine, which is advised to infants under 12 months of age, and any elderly patients over 60 years of age, should be administered at least 2 weeks prior to COVID and flu vaccine, or 2 weeks after the COVID and flu vaccine.
Okay. So Dr. Karbi, many people, what they do when they travel overseas, they get their medicines from those countries. And when they get sick here, or they get any kind of stomach ache or these kind of thing, they have those medicines from overseas and they take that. Even antibiotics. So that is a issue with many of the communities. When they get sick, they start taking antibiotics. And here the physician, the doctors, they never recommend getting an antibiotic unless until you are very serious. So what you'll say about the antibiotics and those who take without doctor's prescription, those medicines from other countries?
I don't advise to do that.
Okay.
I think the best advice is to see your family physician, have a full history and physical performed, and your family physician will decide if you do need antibiotics. Antibiotics are useful against the complicated infections that these viruses can lead to. So if you have a flu and it can lead to pneumonia, a real bacterial pneumonia, then antibiotics are indicated. There's also an antiviral medication called Tamiflu, which is indicated against influenza itself, but has to be started within 72 hours of infection.
Okay. Dr. Karbi, thank you very much for these tips to prevent COVID-19, flu and RSV. Thank you very much.
You're welcome. Thank you for having me.
Thank you. So आज सीगे विलियम ऑस्लर हेल्थ सिस्टम तो डॉक्टर ऑस्कर कार्बी जिन्हों ने टिप्स दिते हैं कि विंटर सीजन के अंदर तुसी अपनी वैक्सीनेशन लो कोविड-19 की वैक्सीनेशन है फ्लू शॉट्स है RSV की जी वैक्सीनेशन है वो भी लो अपने फैमिली डॉक्टर नाल कंसल्ट करो सो दैट यू कैन प्रिवेंट योरसेल्फ फ्रॉम दीज वायरसेस